Well, the first local transmission of COVID-19 in the Philippines was documented on March 7 of this year. 11 days later, our president has placed the entire Luzon, which is the northern part of our country, on enhanced community quarantine, somehow similar to what they call a lockdown in other countries, where people are advised to stay at home and travel is restricted except for the frontliners. Public transportation of all kinds were also suspended. Thus, our cancer patients have difficulty going to oncology centers for their treatments. Also, majority of hospitals in the country have temporarily suspended outpatient clinics, and some centers like ours were designated as a COVID-19 referral center, so manpower has been temporarily shunted to the care of COVID-19 patients. So I think these are the two major concerns of cancer patients right now in our country. First is where will they go to continue their treatment? And second, once they find a center that could actually accommodate them, how will they travel towards that center? But a lot of logistical remedies have been put in place in the past weeks to address these challenges, both by the government and by the private sectors. And hopefully, we get to catch up on our backlogs soon while still ensuring the safety of our patients and healthcare workers. In our paper that's coming out in eCancer Medical Sciences this week, consistent to other published guidelines, our first recommendation is to prioritize the patients who need to be seen at the clinic so that we avoid overcrowding and maintain proper physical distancing. So we basically categorized patients as those needing urgent treatment. So these include patients with ongoing chemotherapeutic regimens with a curative intent and patients on palliative regimens with aggressive tumors, high tumor burden, or impending visceral crisis, among others. These are the group of patients that should be prioritized. The second group are patients on non-urgent treatment. These basically include patients who are stable and does not need to have immediate chemotherapy as deemed by their attending oncologists. Options for this group of patients are to have a discussion and consider a treatment break, switching to oral regimens, or extending treatment intervals if possible. And the last group of patients are those on surveillance. We continue to consult them through the different social media platforms and applications by telemedicine. Our country has also approved the use of electronic prescriptions so that we could refill their medications online. Our next recommendation involves the physical environment of the clinics. It is emphasized that we should do everything that we can to maintain our clinics as COVID-19 free areas because we know from the different published studies that cancer patients have a higher risk of getting infected with the virus and have a higher risk of severe complications once they get infected. So some of our recommendations include controlling foot traffic by limiting one entry or exit point, setting up a triage or screening system, strictly enforcing physical distancing, wearing of the appropriate personal protective equipment, and proper and frequent hand washing. So patients can be screened remotely, for example, over the phone, for symptoms of COVID-19 infection prior to their scheduled visit and promptly advised to seek appropriate care if symptoms are present. A triage or screening area manned by personnel with complete and appropriate personal protective equipment should be in place in all cancer treatment centers to ensure the safety of both the patients and the healthcare workers. Patients who are suspected of having signs or symptoms of COVID-19 need to be properly isolated from the rest of the patients, quarantined, and referred to the appropriate specialists for proper management. Limiting the number of companions each patient can bring with them into the treatment facility is another important intervention to reduce the risk of COVID-19 in the clinic. Modifications to the physical plant and management of clinic facilities will also be necessary in order to control the flow of foot traffic. This will include limiting entry and exit to one or to a certain designated point, areas where people naturally congregate as Filipinos, and I'm sure Americans and people from different countries are very fond of, especially during these times. Areas such as waiting and dining areas need to be actively monitored by clinic staff in order to strictly enforce physical distancing measures. So, vigorous infection and environmental control measures must be strongly implemented within the clinic, and the clinic staff must at all times be provided with appropriate personal protective equipment, and proper hand washing must always be strictly observed. Well, I come from the University of the Philippines, Philippine General Hospital, and since March 30, we have been functioning as a COVID-19 referral center. As such, we had to temporarily close our cancer institute for logistical and safety reasons and had to endorse our patients to other institutions for continuity of care. But we are slowly reopening our cancer clinics and have been serving patients who need urgent treatment on a limited capacity for the past 2 weeks. We are very thankful for the support given to us by the different societies, like the Philippine Society of Medical Oncology, and other institutions and oncologists who have continued to treat our patients pro bono. The challenges of community quarantine measures extend beyond the relationship between patients and oncologists. It also strains the connectivity between oncologists who, under different circumstances, extensively collaborate in clinical and educational endeavors. It is under these circumstances that the importance of an oncology organization comes to the forefront. Through the centralized efforts of the different international and national organizations, communication is maintained between the fragmented pockets of care that continue to function. In addition, through the different technology platforms, evolving recommendations to guide treatment of patients are quickly disseminated to all oncologists around the world. This pandemic has forced us to rethink the way we approach the care of our patients, but with the help of the different guidelines being published from around the world, we can do our best to proceed with care and compassion, remembering always that the safety of our cancer patients and their family and the safety of the healthcare workers are of utmost priority. These are really unprecedented times, but with everyone's help and support, and with a lot of prayers, we will get through this.